Good afternoon, everyone. Thank you for joining us. So today the topic, what we're going to take it up, that is core for modern hospital industry, and it's about leveraging the data for the operational efficiency and the patient care, and improving the patient outcomes. So that's what we are going to discuss today, and definitely the hospital has enormous data which is been getting captured in the various systems like HIS, LIS, RIS, so many RCM systems. Now coming into the AI age, definitely the data interpretation and data modeling has improved a lot, and but still we see that optimum utilization of the data for the operational efficiency, regular decision making is somewhere is like a concern still we can see, and how to take this forward and how it can be mitigated and we can have the best use of the data for the decision making. That is our topic for today to start the discussion. The first point, like to take it up, maybe Premji, we can start with you, and then subsequently I can put a comment on this one. Basically, Indian
Sure.
hospitals generate large volumes of data every day. Well, that's what we see, and we have been into the system from long time. We see that the data capture is the first and the main important activity that happens. Where do you think we are still underutilizing the data in the routine hospital operations?
So first of all, thank you, DHN, for inviting me. And Mandarji, is a pleasure to have a conversation with you online on this topic and this exciting topic. So let me start by saying, see, I've been through different industries in my entire career. So I've been through heavy machinery, mining, then automotive manufacturing, banking, and also IT. But and plus healthcare, of course. So, in all the other organizations, that there's a typical quote which is by Edward Deming, which says that in God we trust. Everyone else, please bring the data. Okay, but when I look at healthcare, so we typically say in God we trust. Please bring your opinions and leave data out of the door. Right. So
Right.
typically the operation data I'm talking about.
Yeah.
So in other areas, for example, manufacturing, the operational data is very, very important. That is uh, that is their lifeline.
Correct.
So somewhere in healthcare, I don't think we have given that much of seriousness into looking at those data.
Correct.
So we kind of capture a plethora of data. In my previous experience, you find huge chunks of data lying which is not mined. Right. So we don't have a problem with data, but we do have a problem with making those decisions with the data.
Correct.
Right. And what I would also say is again, generating a data, yes, but converting it to kind of make it predictive, preventive, and also kind of assess the performance to drive the actions. So
Right.
when I look at which areas that we need to focus, I would normally say it is let's start with the discharge. Right from the word, uh, doctor says the patient can be discharged and till the time when exactly the patient is getting discharged. So you see a huge gap, right? And if
Correct.
I'm not
Yes.
able to predict that this bed will be vacant by 12 p.m., when I'm running my algorithms at 9 a.m., which means that there's a lot of process which is broken,
Correct.
right? And the capture of the data has to be appropriate so that we'll be able to get to those levels. So how many hospitals today can say that this is my available capacity? That's a very rare case, right? So
Yes.
similarly, these are some of the areas that kind of I would say help in making sure the patient outcome is to a great effect, right? When we solve these kind of problems. And the
Correct.
second is when we look at patient onboarding, that also takes time,
Yes.
right? And how do we optimize that using the data?
Definitely, yeah, definitely. Thank you, thank you. I totally agree with your points, and definitely data is there, but using it for the optimum use and for the decision making, that somewhere still lacks. As you mentioned rightly about the discharge planning, definitely data is with us. Okay, what kind of steps and stages it has to go through from the discharge intimation till physical discharge. So touch points and data entry points all are available, but tracking it and monitoring it, definitely it's rarely it happens basically. It all
Yes,
through the manual communication that happens, but no one is looking at the data. Okay, where exactly we are lacking, what process is getting delayed, and how to best optimum to improve that process. That is somewhere we don't see basically in the terms of the data and other control. Those are also lags somewhere. Like those are recorded only for the purpose of like any basic QAs and so many things are there. But okay, definitely, if you start looking at the data on a regular basis and if you see that definitely the infection can be controlled in such a way that okay patients are safe and the safety protocol has been achieved. So that is somewhere also we can start looking at the data so that hospital has an opportunity to look at the data and interpret okay what kind of challenges could come in the infection tracking and other thing. Obviously, when
absolutely.
we talk about data, first thing that comes is the collection or the revenue generation. Okay. But that is tracked like okay revenue has been generated, what has been collected, what is the outstanding, that is being tracked. Okay, but no one sees okay where exactly my revenue is getting leaked. Okay, what is the gaps are
Absolutely.
there, what are the challenges that could come in future in terms my revenue goes up and down, something like that. What is the variation that is going to come, and what is the control mechanism that we could have looking at the data. Okay, where exactly the wastages are. So that's something definitely data can play a huge and humongous role in interpreting those touch points, giving the prediction. Instead of doing the postmortem, definitely one can look at the data and see okay what processes or the steps have to be taken to control these wastages basically. So that's what the data is very
I,
much important.
I'm going to
Yes.
give you an example. Okay, so in the recent news, there was an article which says that about 1,300 plus clinics and 400 plus smaller hospitals were closed down in Kerala.
Oh,
Okay, so this is because of escalating cost. Thought behind that is when you only see revenues, right, and when you don't look at your current ratios,
correct.
right, so you don't know where your revenue is getting leaked, right? So revenue, okay, it's basically ambitious. It's an ambition, but cash flow is discipline. So unless you track it on a regular basis, and if you are less than one or equal to one or greater than one, that defines your survivability on the long run.
Yes.
And most of them they look at what is incoming, right? And there is no planned outgoing as well.
Yes.
But if you look at the budget cycle in typically in healthcare, I don't think there's much preference given to that. So whatever the figures are, basically somebody would have created that number about years back. You add on a percentage to that and you keep moving on. So
Yes.
there is no market study to arrive at that budget.
Right.
When you have data, you need to look at all these aspects, right? That's very important. And the second point is I'll give you an example of predictability. In my previous experience, we did a small exercise. Okay. So we had the OPD data. We took it up,
Okay.
we took it for a month. So because we couldn't take it more than that because the patient volume was about anywhere between 2,500 to 3,000. So we could basically, in order to run a simulation on a laptop, we just took for a month. So we kind of correlated with the temperature in Bangalore,
Okay.
or I would say the climate in Bangalore. So whenever we see rainfall and a drop in temperature in Bangalore, so the prediction was the patient load is going to get increased in 3 days. Okay. So what I'm trying to say is we have huge data as in healthcare, right? And we also need to know how to mine it.
Yes.
So these kind of prediction models can give you a lot of, I would say, it will bring in a lot of operational efficiency in the system. So we haven't gone and reinvented the entire data structure in incorporating new parameters. No, we just figured out what we can do with the data.
Right. Yeah.
So we would need somebody who has a SME in understanding those structure and the business logic and arrive at those simulations. That would really help.
Correct. Correct. Yes. Definitely. Totally agree with this point. Yes. So someone has to drive it and be it in there and drive it. Okay, this is what we are going to come out with the data. This is what the
Yes,
outcome that can
yes,
be achieved. Yes, definitely, totally agree. Yes.
yes. So
So
I'm also getting remembered of another quote. Okay, so this is by Peter Drucker. What gets measured gets managed, but what gets ignored manages you. right? It is typical in a hospital environment, right? So if
Correct.
there are a lot of things we miss out on certain points, and then we run helter skelter to meet those demands, right?
There could be one example within the hospital, okay, that really has stood up significantly, looking at the data, and that has improved the efficiency and operational efficiency basically in the hospital. Should I avoid the operational bottleneck, and like to discuss one or two examples with this, where definitely the data has helped in achieving those outcomes and the expected results in the hospital operations. So, can we take up those one or two examples where you can discuss and see?
Yeah, I have many examples, but I will put two here in
Yeah,
interest of time. The first thing is, in my previous experience, we were kind of sitting in the reception. We were analyzing, what is the wait time of the patients. So the earlier process was patients used to come, they used to take the form, they used to fill up all the information, including the name, age, gender, and all that,
correct.
and they
Yes.
will stand in the queue.
Hmm.
Writing, let's say it takes about 3 to 5 minutes or even 10 minutes for
Correct.
somebody who needs assistance. Then they go stand in the long queue wherein you have about 20 to 30 people ahead of you, right?
Hmm.
Then after that, once you reach the counter, then again the operator there or the billing clerk there types the entire information and adds you to the consulting doctor. So that would take some time. So we found that the wait times were anywhere between 1 to 1.5 hours, or even let's say 45 minutes to 1.5 hours, depending upon the day of the visit. Normally, we find the peak load on Mondays, Wednesdays, and Fridays, right? So uh, typically 45 minutes to 1.5 hours is the wait time that we found. Then what we did is we kind of converted those entire what do you say patient onboarding onto a kiosk.
Okay.
Okay.
Hmm.
So what we are doing here is rather than giving the accountability to the billing clerk on typing the name of the patient right, we are given the accountability to the patients to type the right.
Patients.
So they come in, they type their registration in the kiosk, then it generates a QR code and a reference number. It doesn't take much time for them, and then they go
Correct.
stand in
Correct.
the queue. So we have basically seen a reduction of about half an hour, a 30 minutes reduction time we saw. I think that's a very good, I would say, progress that we made. Right?
Definitely.
And this is one
Definitely.
example.
Yeah.
The second example is so when we moved from a paper-based approval system to a electronic system, an ERP with a workflow. So what we typically did was we carry forward the entire paper process to a lengthy workflow in the electronic system and digital system. So it had about, let's say, 7 approvers for every PO, for every penny that is approved. Okay,
Right.
if you raise a PO for 1 rupee, it will go to 7 approvers.
Yes.
So, in typically in a hospital scenario, you have implants coming in,
Correct.
right? And these have to be billed so that the patient is also discharged in time. And we found that the wait times were increasing because of the delay in these 7 approvers. Okay. So when we implemented, we already moved 6 months down the lane with that solution, and we had 6 months of data. So me and my team, what we did is we pulled out that information and we quickly drew a box plot, and we knew where the problem was. So when we went and asked people, they said, "I'm approving every day. I don't think I am the cause for the delay." So we called people into the room and we projected the entire analysis on the screen with the data. Then they agreed, yes, there is the problem. So it happened so that we removed the entire 7 layer of approval for implants from taking anywhere between 6 hours to 12 hours. We basically reduced it to less than, let's say, 5 or 10 minutes.
Oh, that's great.
Okay. So now we were trying to look at different areas of improving in those matters. So why I'm saying that is the data that is captured is very important. Right? If
Yes.
we are still stuck with the paper,
Yeah.
we would have been still stuck till now.
Correct. Correct. So that's where the data helps and the system helps in optimizing
Absolutely.
those processes and improving those efficiency. Definitely. The first case, what you discussed, similarly, it is applicable for us as well. Like looking at the stat which is there for the patient visiting the hospital, coming to the lobby, then going to the billing section, doing the billing, then going to the waiting area for the doctors, nursing vitals, then meeting the doctor. All those have been eliminated with just monitoring the TAT on a daily
Mm,
basis. So those processes have improved a lot. We also enable few of the systems where the patient can do the self check-in and other thing. So that is also help in that is getting implemented. But yeah, the outcomes are great out of that one and eliminating those wastage of time for the patient when he comes for the first time or for meeting the doctor. Definitely, he's in a position and he's in hurry to meet the doctor first to
yeah.
express his concerns basically. So that's where we have the system has helped us. Second example I'd like to take it up is about the discharge planning. We mentioned and talk about this point earlier, but there is some dashboard which has been created out of the data.
Mm,
So it improved help us a lot in improving those discharge timelines basically. So discharge intimation it is to happen on the day of discharge by the doctors. Now we are planning it in advance. They say, okay, tomorrow these
mm,
patients are going to likely to be discharged. Okay, so at least their lab and medication orders are checked, verified. Billing is at least that point out is completed and audited, kept ready. Discharge summary is being updated, and the next day when the doctor comes and says, okay, this is the final discharge confirmation that is going to give, then obviously the everyone is in place. Okay, this part has been done. Now we can go ahead with the clearances. The remain part is basically with the nursing notes, the nursing returns, pharmacy acceptance, discharge summary finalization, and the discharge medication. That's the only point that's remaining. So that help us in eliminating the time which is going for the at least for the cash paying patients, regular patients. So at
nice.
least those time have cut down significantly. Insurance, there is a dependency on the insurance companies about the queries, approval, so many things. Yeah, but definitely the timeline has improved at least in house parameters which are there. So at least external parameters have been considered and taken care very nicely so that patients are not waiting for a long time after the discharge confirmation has been given to the doctor. Definitely for the patient, discharge timeline start when the doctor says, okay, you can go home. You are pretty
Absolutely,
much go
absolutely.
home. Okay. He doesn't think about what process are going to follow into the system, what has to be done, what discharge confirmation, what nursing returns. He doesn't care about anything. I want to go to the home. It has to be done quickly. But definitely, this kind of data interpretations I definitely help in looking at those objective, improving those, see where we are still making mistakes, some gaps are remaining, and definitely covering those as we review, as we monitor, as we oversee those parameters and improving those. So that's how it has been helped in a long way. Definitely that improvement will come. A lot of dependency there, but yeah, definitely that line has been started where we see that improvement has been going upwards. Okay.
No, nice, very, very nice to hear. So changes will be there. So it is a continuous, I would
Correct.
say, journey, right? So
Hmm.
we have to keep improving. So we know there will be certain cases where certain, I would say, a certain structure would fail, right? So we would
Correct.
need to kind of rethink. We need to brainstorm, come out with the actions, and then again add it to the process. So it is a continuous improvement that we need to follow.
Correct. Correct.
So, talking about continuous improvement, so one thing that strikes me is that if you look at the industries, right? So if you look at manufacturing, pharmaceuticals, say automotive, shipping or aerospace or whatever, so they do follow Six Sigma or a lean methodology,
Yes.
right? So that kind of bring what they do is they imbibe that into the culture of the staff,
Yes.
right? So that you are aware on which tools you need to use for problem solving. We don't take a guess, right?
Hmm.
And that is taken with the data that we have. A
Correct.
similar thing at a hospital would make a lot of sense so that we'll be able to kind of review the process timely, we'll be able to identify the root cause timely, and we'll be able to make sure those actions are taken and the outcome would be much more beneficial than we expect today.
Yes. Focus on the efficiency. Focus on the
Yes.
operational optimization. Okay. Don't look at the wastages which are there. Eliminate those. And for that, definitely data helps. Okay.
Yeah.
Identifying those gaps, identifying those pointers or the parameters which are reducing the efficiency. Dashboards are there. Definitely, these all tools, the skill sets, and so many
Mm,
efforts have been gone into developing those dashboards. Okay. But
mhm,
still, when it comes for the decision making, it's on the experience. Okay, the management or the senior management, definitely the officials look at the experience. Okay, this is how it has happened. This is it was happened. This is how it is used to happen. So it correlates between the experience and the data gets ignored. Okay, and data is not backed up for those decision making. Okay, so how we can have that kind of shift in intuition, changing intuition based to the data back management. Okay, right now it has been experienced, so we have to change to the data back management. Okay, this is how the data is coming to us and this is what decision should be taken ahead. So how we can have this. Okay.
Okay, so in today's world, you have a lot of those BI tools. The question is, how many in the hospital know to use those tools? So even before we get here, so there are three sets which we need to follow. The first is a mindset.
Yeah.
So that is defined by the purpose the hospital exists. That correlates with the objectives of the leadership on how they want to take the hospital forward, right? And second is the skill set available of the staff who can mine the data and give them certain values which are hitting their top line or bottom line.
Correct. Yes.
Okay? And the third is a tool set. Now, if you have the skill set, you need to have tools, right? So these are the three, I would say, the essential sets that any organization would require.
Right. Right.
So first of all, what I'm looking at is where I come from. Every year we used to have a kind of a vision board exercise or an objective setting exercise, right?
Right.
So which will give us an indication where we are heading. That
Yes.
that's get converted to metrics that get converted to your what do you say performance pay XYZ whatever, right? So I think these metrics are kind of absent in healthcare. All right. There are some corporate hospitals, yes, they do have these metrics, which is working wonderfully for them. But there are a lot of other small and medium hospitals which would need to adopt this kind of metrics, right? So these
Correct.
are nothing but you are capturing the data.
Yes.
You're capturing the data to like um, from where you're moving from point X to point Y, right? You need the objective
Yes.
set, and that those objectives get drilled down to KPIs, and those KPIs are taken from the data that is there in your system, right? And if we identify certain KPIs, for example, I said the current ratio, right? That is one of the KPI.
Yeah.
So you can show a lot of colors on the dashboard. You can say this is my revenue, this is my expense, this is that, this is why. But if you don't tell them where they are lacking in the dashboard, that is where we see the gap.
Correct.
Right?
Yes.
So previous experience, we used to create a lot of dashboard, but those are very attractive numbers and so on. They get pleased, right? But if we don't mention that when and where the fall is going to happen and what is your current state now, that is where we fail in making the data visible to them,
Correct.
right?
Yes.
So not every I would say management staff in the hospital is I would say MBA or any other management graduates, right? Or senior. So what I'm trying to say is, if we have those people in the top layer, then obviously the challenges for other people to convince them would be much simpler.
Correct.
If
Correct.
not, then we would need to make sure that those data is visible to them and what are the implications of the data is explained clearly to them. Surprisingly, we used to use these dashboards in our pharmacies to monitor the stock and the return. Okay, these are Power BI dashboards which we use it on a regular basis, which is again plugged into SAP. So they
Correct.
used to monitor it on a regular basis. So it gives them a lot of insights.
Yeah.
And basically it helped them to reduce the number of returns as well.
True.
So, and this is on the pharmacy side. But for management, I think they have a long way to go in terms of understanding what this is trying to tell them. Right? Because they are
Right.
too busy in dealing with the other issues, and this becomes a
Operation.
lower priority in their entire value chain.
Correct. Definitely, management basically will keep on be looking after the priorities which are there from the operational point of view and the execution point of view.
Mm.
But there has to be definitely a buy-in from the leadership to look at and demand for the data. Okay, the data has to be demanded, and right and accurate data. That's something trust has to be built within the stakeholders and the management and the each and every aspect of the organization. Okay, the data which is coming to us is a trusted one. It's not
Yes,
something
absolutely.
correct. Yeah.
perception for them is whenever they ask for a data, somebody dumps an Excel sheet onto them, right?
Correct.
And
Yes.
when they open it, they don't know where they are. So they feel
Correct.
confused in seeing so many of
Uh-huh.
information. But when you kind of see these things, these changes happen slowly. When they when they start to see the charts and graphs and the
Mhm.
color coding that is there on the dashboard, slowly they kind of adopt to this pattern.
Right. Right. And it also helps to build the ownership, like someone is owning the data. It is not like management is owning the data or the IT is owning the data. It's the business that is owning the data. We know this is what the data is. I know it. It has been trusted, validated, and accurate. And
Yeah.
that's when the interpretation on the data comes out properly for the management to take the decisions. Okay, so
Yes.
that kind of ownership and the trust has to be built as a culture. Okay, okay, what the data is going to come to us and what is coming to us, it's accurate. I have validated the data,
Yeah.
so that definitely helps in building that ecosystem where
Yeah.
the decisions are taken on basis of the data systems. Yeah, thank you. Rightly touch points on this aspect basically. The next point, what we'll take it up is about the structured data, structured and unstructured data. Mainly, if you look at the RCM and the material management, SCM, and so many other HIS modules which are there for the healthcare industry, those are basically having the structured data. Normally, we talk about the RDBMS, SQL,
Mm,
Postgres, so many
mm.
things are there. The tabular data is there. But when we go to the clinical data, definitely the clinical is the longitudinal care data that we see. The patient is being visiting us from almost from last years, multiple visits, multiple episodes, so many admissions, medication has been taken, investigation has been done, clinical trials, clinical records, doctor visits, so many things are there. Okay, so normally it becomes a longitudinal care data. Okay, and as we see the clinical systems, definitely lot of data goes into the unstructured way. Okay, it's not structured much. When we talk to the patient, definitely doctor says, okay, this is what patient is diabetic, patient has the history of so many things, patient has family history of this thing, and then we are arriving to this conclusion. This needs to be done. This is the treatment plan for him, and then accordingly the data flows basically. So it's partial structured, partial unstructured. Okay, so how that structured data will help reduce the variability in the clinical practices while we still respect the clinical judgment what is going to come out of the data, but still data and structured data helping the patients, helping the doctors and the hospitals to take the proper decisions. So how that can be leveraged.
Yeah. So I want to take an example of manufacturing aerospace. So if you look at the information that comes out of the vehicles, right? So
Hmm.
in every vehicle that is manufactured across the world, you have a port called OBD2, which is called onboard diagnostics port.
Yeah.
Right? Similarly, there is one for the aircraft and ships and all the other IoT devices which is there. So what this does is, irrespective of the vehicle model or make, wherever it is getting made in the world, so the structure of data is the same. It is a global standard, right? So similarly, you have in other areas also. For example, banking,
Yeah.
right? So if you want to move money from one bank to the other bank, so both banks do a handshake to ensure the money is transferred, which means that there is a common standard template that is used,
Yes.
right, to transfer the money. So similarly for healthcare, I think ABDM is coming out with a lot of these initiatives. That is one, and second we have FHIR standards,
Correct. Yes.
right? And today we seldom use these standards in whichever HI system that we use,
Right.
right? And if there is a regulation which comes that these are mandatory, then you will have structured data across hospitals,
Yes.
which means that if you're moving from one hospital to the other hospital as
Another
well, your
hospital.
data is structured. So
Yes.
the reason that it has happened is because over the past few decades, right, whoever the HIS vendor comes in, so they are basically put to customize the entire platform to the needs of the hospital, right? Which means that it is different from hospital to hospital. A single vendor will have different versions of software running in different hospitals, right? Somehow the standardization was lacking,
Yes.
right? So today, what has happened is we have a lot of unstructured data because of that,
Yes.
right? One is because of different software, and second, within that software, there are provision to type different things in different places.
Yes. Too much configuration.
Too much configuration. Now, if we try to mine that, you're not going to get a very good output.
Correct.
And on top of that, you have those uh, DMR information also, right? Digital medical record, the scanned
Yes.
paper which goes into the system,
Hmm.
which somebody indexes with the date and the patient ID and the doctor's name and so on. So we interestingly we are working with the HIS vendor for one of the projects. Okay, so what we are trying to do is we are trying to extract meaningful information from the DMR.
Oh.
So there are templates which are available when the doctor fills things in the right place. Yes, we are able to extract. But there are areas where doctor has written a lot of things in one sheet, or multiple doctors have written in one sheet, right?
Hmm.
So how do you figure that out? So those basic complications are there, right? See, the one thing that we need to look at is getting into a full-fledged EMR, right? So unless or until there is a kind of, I would say, a regulation which comes in from the NMC or from the government that this is the structure we need to follow, right? It is very
Correct.
difficult to maintain that data in a structure format in hospitals.
Yeah, definitely. Because when you go for the implementation of the EMR system, the doctor are more keen on having the unstructured data. He likes to say, he or she likes to speak, and that gets recorded, and everything has been taken care. Okay, hardly CPOE will be done on the like in systematic entries, but history, chief complaint, or your treatment plan, care plans definitely goes into the unstructured data. So someone has to sit down, interpret, and then see, okay, what exactly has to be done for the patient. So and what kind of interpretation was done by the doctor. So definitely that lacks somewhere. But
Yeah.
having these AI systems in place and now these models are getting developed to interpret that data, organize it, and structure it. That is the age is going to come. Okay, where we can utilize these tools, new tools, and help the doctors. Okay, they are also capturing in the way and the speed what they are doing the at the time of patient care. But yeah, and data is also captured, getting captured in the structured way. So definitely there's some investment and some technology innovations are going on. So that will be the thing to look forward for in terms of getting implemented such systems in for the such facilities like doctors and the nurses. That is going to be help.
Yeah, absolutely, absolutely. So we are incidentally working on a POC using a similar setup like a cloud bot. So these can be used along with the locally installed LLMs, a small LLMs, or I would call it as an SLMs with a less than 4 billion parameter, right?
Hmm.
And it can be trained contextually so that it captures the conversation and records it in a
Right.
structured
Yes.
format. So
Yes.
these are the solutions will make a lot of sense for hospitals, right?
Hmm.
Rather than dwelling on a bigger AI system or
Hmm.
subscribing to a larger AI platform like OpenAI or Gemini. So these kind of smaller things will add value to the hospitals in ensuring
Yes.
that unstructured data is converted to a structured data in the FHIR standards.
Right.
Right?
Yes.
And later these data can be synced with your RDBMS or
Yes.
a non-relational database like a MongoDB or whatever. So that will give you a lot of structure and that will give you the ability to mine these information at a later point in time.
Right. Yes. And a lot of governmental compliances will also be taken care, I think, because
Absolutely.
definitely you have to submit data for the tuberculosis, then the diabetes, and in certain season, definitely those cholera and other things like jaundice or the dengue patients, the data has to be maintained, tracked, and submitted. But when we do the regular entries into the system, the data is not captured in that systematic way, whether the patient is diabetic or not. We just say, okay, patient is diabetic, patient non-diabetic.
Mm,
It's not true or false or yes or no options that we are going to tick. The doctor is
mm.
not keen on clicking that buttons. He's
Absolutely.
recording. Yes, he's recording the history of the patient. So, and we also cannot go and take out some time, do this click there, click these buttons, and so many things. That is not the case for the doctors to do the EMR entry. And definitely, as you mentioned about this LLMs and small scale LLMs, definitely helping the system to build that intelligence where the unstructured data is getting converted to structured data, and that can be
Absolutely.
interpreted, used for the further analysis. Definitely, it's a big achievement in terms of the technological innovation point of view in mitigating those gaps which are still remaining in the system, and
Mm.
definitely for the healthcare industry where we cannot force end users to use the system, where the doctors are the
Absolutely.
key one. Yes. As we move ahead, definitely we see the systems which are there in the hospital are used to work in silos. Okay, that the health, EMR, then the pathology or radiology, billing systems, material management, pharmacy, and supply chain management. Their systems all together run differently. There are a lot of other ancillary things are there, like CSST. We have paramedical staff management, those activities. So having this all this data in silos, different silos, and their needs are different basically. The needs are not common one. Even though we are serving the common purpose of helping the patient or treating the patient, the needs of the data are different for each and every one. So what is the impact what we see of these different silos on the analyticals? Okay, analytics and data analytics basically. What is the impact what we see?
So impact, what we see is, see, island of solutions are deployed in hospitals, or rather in, I would say, a lot of industry. It is not only to healthcare; it's common across industries. So typically, what happens is, I'll give you an example. Let's take an example of an HIS system and a HR management system. Now, if these two are not connected, right, and the doctors applies for leave, right, and how will the HIS system know that it cannot book the consultation against the doctor? Right?
Yes.
We have seen a lot of cases like this, right? So
Yes.
today, see, earlier there used to be a manual system. Doctor calls up and says, "Okay, so I'm not available today. Don't book." Yes, they will not book. But when you get into an app kind of a system where doctor applies online, and these systems have to sync with HRs to ensure the appointments are not booked against the doctor.
Correct.
Or rather, a doctor should get a notification saying that you have so many patients lined up for today. What do you want to do? Do you want to cancel the appointment or do you want to cancel your leave? Right. So the to integrate these two things, there could be a technical challenge, there could be a functional challenge also.
Hmm.
Right. I'm just giving you a very simple example, but there are much more complicated, like your fax information, right? Laboratory information talking information system talking to your HIS, or your blood bank system talking to your HIS, or whatever, and your staffing system talking to HIS. So integration bottlenecks are there, and it could be mostly because of these systems are legacy systems,
Correct.
right? So most hospitals today run on a client server architecture, right? You have the front end, which is as a DXE on your desktop, then you have a back end, which is somewhere lying in the server. So when you look at these monolithic, we call it as monolithic systems. When you look at these monolithic systems, then which you need to either talk to the DB directly, which is not good
Hmm.
because we don't know how. And most of these systems are designed in such a way that there is no entity relationship diagram documentation available. So you have to figure out based on your experience,
Correct.
right? So such challenges are there. And for example, if you have purchased a new HI system and if it is not talking to an LI system, it complicates a lot of things, right? And plus, people who are used to the LI system, they don't want to upgrade, or people who are
Yes.
used to the PAC system, they don't want to upgrade.
Great. Yes.
Somewhere to kind of balance these two, you need to kind of build an integration pipeline,
Yeah.
right? And you have a lot of challenges associated with that. And um, sometimes we feel that you need a middle layer to basically take these two communications, then process it and push it to
Right.
the software separately. So there are a lot of, I would say, the architecting challenges that is a kind of prevailing today in the industry, right?
Hmm.
You have we call it as operating technology, right? The operating technology can be a newer technology or could be a legacy technology, and somewhere we need to live with both.
Yes.
So it is very essential we understand the capabilities of these two and only integrate the points that we are looking at in the long run.
Those are developed by different vendors, so they have their own understanding of the solution problem, then the solution, then the that it has been developed, and how many places it has been implemented. and how much it has been matured. So that's where the differences come. And silos, now the silos within the laboratory radiology are somewhat getting eliminated because the HIs are offering the multi-model and multi-modular systems to the hospitals. So that is somewhat getting eliminated. But still, if we talk about HRMS, if you talk about accounting or ERP systems, the other ancillary module systems, those are still out of the HR system. The HR becomes a core, but this becomes a supportive systems for them. But having those touch points, sharing the data across the system is important for the organization to take care of the certain decisions. Okay, and certain look at the supervise certain processes. So that doesn't happen. So it depends heavily on the people who are managing those departments, managing those functions, come out with the data, match it. So there's a heavy lifting that happens on the modeling the data, looking at the data points from different sectors, combine them, then take it to the management. Okay, that's where we see the challenges. Okay, the delays happens, the data is not correct, there could be some manual errors because the data is being handled manually. So that's the challenge comes in terms of the data and the decision making. Okay.
Yeah. So
And
typically, what
ownership.
we do is before we venture into these integrations, we do a complete of the entire process, right? And second, we also do an exercise on for DFT, data flow diagram. So we know what information that is required between these two systems. We basically integrate those aspects only. And before integrating, and I think this study is very, very essential, right? And unless you have a DFT drawn and signed off by the two parties, if you do the integration, then you're getting into chaos.
Correct. Definitely, that mapping, end-to-end mapping, and the touch points are discussed, documented. It's very key for the integration to happen successfully. Unless that is being done, it will like a chaos. Okay, and no one will have the ownership where the data flows, how it flows, and what kind
Mm,
of data is getting shared across the system. So that having that
absolutely.
documentation, clear vision about the data flow diagrams, and what kind of data is getting flowed. Okay, there could be some sensitive data. Now the DPTP is coming up, data fiduciaries and data processor have to be very on the strict lines to ensure data is not leaked anywhere, and all the touch points and integrations are taken care properly without uh, any chances of data leakages and the breaches. Okay, that's that's something that adherence has to come within the system, within the organization, so that they are not considered as data, a breach can happen into the data. That something has to be taken care properly. Yes. So for the hospitals, let's say this hospital networks that want to start becoming the more data driven. So what should be prioritized first? Because should we say technological investment or data governance, leadership mindset, or a process redesign? So how you can like to rate it? Okay, what should be come first? What should be second, third, and fourth to
Okay.
enable the hospital or the hospital networks to start more looking at the data and taking the decision on basis of data.
So we talk about that three sets, right?
Yes.
Mindset, skill set, and the tool set. So first we look at the mindset, right? So mindset basically
Yeah,
encompasses
obviously.
your leadership mindset, and plus it also brings in technology investment. You need
Correct.
money. So you need money from the leadership only, right? So and second, when we look at let's say data governance, right?
Yes.
Hello, data governance aspect. So that basically is a skill set.
Yes.
You need to know where you need to derive the data from. You need to know who has access to the data. You need to know what you derive out of the data. Right? So
Correct.
that is basically on, I would say, the uh, data governance part. And the last part is your tool set, right? So the tool set basically is the skills as tool set is basically the process redesign that you would need to have, right? You need to have a
Correct.
tool which kind of helps you look at your processes, then understand the data flow, create the visualization according to what is required. So
Correct.
we'll
Correct.
start with the mindset stuff, I would say skill set and the tools.
Correct. Completely agree with this point. Mindset should be like there is no should not be any compromise on the mindset. Basically, the leadership mindset has to be in place. Okay, they are asking for the data and
Yeah,
system generated. It should not be a manually enter. printed data, should be systems driven data that is going to come and it being looked at. And data governance, obviously, that's the like something which we definitely have to put focus on data governance, having this TPDP on the door. We see data governance, data ownership, right data at the right point and validated by the right person is very much important in terms of this DPDP ecosystem or it be a analytical purpose. So that's where definitely the priority comes for that after the mindset. And data helps defining redefining the systems and the processes because you know where the gaps are, where the mistakes are, where the improvements can happen, and continuously monitoring that data points and data parameters is very key for the organization to improve on day by day. Okay. So that's why definitely. And fourth thing, definitely, as you rightly mentioned about the technological investment. When you see this process has to be improved or changed, you then start thinking about implementing the system, looking at the right solution that will cover up these gaps and that will cover up these mistakes which are happening in the systems, and then definitely see for the right solution to get implemented over there. And when people understand, okay, this is where the challenge is, then the right solution is accepted and adopted by the people also. Or else you just bring the system, there will be a lot of resistance that comes from the people in implementation of the system or any of the solution. But when they say this is where the challenge is, and this challenge is going to address by this particular solution, that's acceptance come by default to the people. The mindsets keep changing day by day, looking at the data and looking at the solutions which are going to address the concerns and the gaps. Definitely, people start looking forward for the having the better optimization, the efficiency. That's what really like to touch.
Absolutely.
Thank you.
So
Thank
we
you.
need to bring the data in the front, right? So if you look at some of the organizations, they have a digital cockpit or digital control room. You have a plethora, let's say, plethora of screens displaying a lot of these metrics. So we typically see this in the airport, in the let's say manufacturing plant. We see it in the what is it in the banking, right? So similarly, and in hospital also we see it, but that is in the IT room, right? We
Correct.
see how many servers are running and what are the performance of those servers, what is the hard disk utilization, this, that. But ideally, we need to have a complete a control room for the HIS ecosystem,
Correct.
right?
Yes.
That is tracked visibly,
Yes.
right? And
Balance scorecard.
and balanced scorecard. So bringing the data to the front also creates transparency. That's something that the leadership should also believe in.
Should be seen on a regular basis with the comparison with the previous day, previous month, previous year, what we have done today, what we have lacked today. That has to be done on a regular basis. And all this will happen with the data, correct and right data. That's
Yeah,
great to see.
absolutely.
So last but not least, looking ahead, definitely as we see the predictive analysis and the AI-driven decision making is already happening. A lot of LLMs models, frontier models are helping the IT system and the businesses to take the decisions, validate their decisions. But do you believe this Indian hospitals are ready for such kind of predictive analysis and the AI-driven decision making or decision support system? Are we definitely ready, or what do we need to do to strengthen the basics of data discipline? So there are two questions basically to
Okay.
you. Are we ready?
Just think there's any straightforward answer we can come out with. So, so from my perspective, if I look at healthcare value chain, so we have started with a prescriptive service, right? So when a patient feels that he has a temperature rising or he is kind of unwell, he goes to the doctor. Doctor prescribes some medicine. They go to the doctor. Second, and slowly we are moving towards preventive care, where we take up this precautionary health checkup, right? So to understand, where we are heading in terms of lifestyle diseases or any other ailments that we have. So these two are actually happening in tandem. And now I think the preventive care is increasing day by day, right? You have a lot of patients doing a checkup well in advance, right, to understand
Yes.
that how their body is performing as they age. So the third is the I would say the predictive. Today, a lot of companies who take a sample of your blood and tell you where are you going to end up, right? And there are a lot of, I would say, apps which kind of takes a picture of your face and tell you whether what is your heartbeat, what is your percentage of cholesterol that you have, XYZ, whatever. There are about 40 parameters it gives you. So these are basically catching up, right? And over a period of time, we might get into a scenario where it is precision. Right? So where you can see hospitals having drug manufacturing units which 3D prints the drug as per
Independence.
your dosage and requirements, right? So what I'm saying is to get there, we need a lot of data. Right? So every person is unique today, right? And every person's data is unique. You cannot take an average and do the treatment like what we do today, right?
Right.
So,
Yes.
so if you have let's say a fever and you go to a doctor and they will take your weight and say, okay, if you're over X, you take 60, 50 mg of paracetamol. But that is based on average, right? So going forward, if we are getting into precision, you need to have a lot of data. You need to have a lot of clinical data that is captured, apart from your lab laboratory report or a PACS or whatever. Those doctors' subjective diagnosis is also required, right? Which captures your allergies, which captures um, your pain intensity, which captures a lot of these parameters is required. So if we need to get to that point, so these data, the capturing of data becomes vital and the capturing of structured data becomes vital. Only then we'll be reaching that stage where we see a modern medicine helping us out in expanding our lifespan. Anyway, that,
Right.
that is what healthcare is all about, right? Improving our lifespan of in the world. So what I'm looking at today is combining the 3D printed drug with, I would say, genomics, combining that with an AI algorithm, and most importantly, combining that with an EHR
Correct.
will improve the patient outcome tremendously in the future. I think we,
Right.
we are all heading there, but it depends upon how fast we reach there, right? To reach there pretty quickly, you need to have those data in place.
Correct.
I think
Correct.
today
Rightly
the
said.
healthcare needs to concentrate on capturing the data in the right.
Correct. Right way and the consistent data and the structured data.
Yes,
We also see now the demand is raising for the structured data. People are, the doctors and the management is asking for the structured data. Okay, you are doing the EMR entry, you are doing any kind of system implementation, look for the structured data. That will help us in future to interpret, to predict. So that is what the demand is also getting raised. A lot of awareness is also happening in terms of the AI solutions and what ChatGPT when it got introduced. Kind of the
mhm,
uh, mindset that came. Okay, what and how it should be used, and that is where the things started moving for the hospital and for the healthcare fraternity. And definitely, the people now looking for the standardization, the documentation that is coming to the place, and also it is helping for the patient and doctor and the clinical team to build a trust among each other. Okay, there is a trust now that is coming to it. The people are also now avoiding that kind of searches which used to happen a couple of years ago, the Google search. Now that is also 1811. Now people are aware, okay, this data can be fake. We have to go meet a doctor and see, okay, what exactly is the treatment plan. Okay, that's where it's coming up, and how it is going to help me in future. So that kind of knowledge and awareness is coming to the all the stakeholders who are involved in all this healthcare fraternity. So definitely it is helping us. Okay, and as I said, clean and structured data and the proper and consistent documentation. That is key for us to go ahead in terms of predictive analysis and the use of AI into the healthcare industry. Definitely. Some short-term wins also have started coming to the place. Okay, like we see the pharmacy management or the material supply chain management in terms of this voice to text and text to speech. The voice bots are coming up. This medication recommendations are coming up. Diagnosis, differential diagnosis coming up. So all these things are happening, and that is why it is happening. It is because of the data. What data has been captured, how the models are trained, and definitely we have come to a stage wherein we can see, okay, this is what the accuracy has been coming out of this LLM models. So that's how the trust is getting established on these models, where we see, okay, how it can be matured, how it can be taken ahead, what kind of information it needs to get matured. So that kind of awareness is
Absolutely.
started. Yeah,
So what I'm seeing is with the lot of the gadgets also coming in, right? Your smartwatch and everything, which captures your vitals as well. So
correct.
maybe 5, 10 years down the lane. So initially, we don't have to come to the hospital, right? So normally, you pick up the phone and you call, and AI bot answers saying that what is your problem, and it asks what is your temperature, and then it looks at your smartwatch and basically picks up
Correct.
your vitals. Then it'll basically suggest you the first phase of treatment also, right?
Yeah,
Then it'll say, okay, so if you're not getting well, then you come to the hospital, right? So what I'm
correct.
saying is most of the first phase of analysis or first phase of assessment of a patient will happen with an AI bot.
Correct. True.
With a lot of language, large language models getting mature information or trained on a mature HR data, sorry,
Yes.
healthcare data, right? This
Yes.
is a possibility.
Yes. Definitely. Definitely. We see that happening on a regular basis when we connect to the people across the board about these AI tools. A lot of healthcare data is getting matured and shared across, and the models are getting trained to come to that accuracy level. That is really happening. Yes, and that is definitely the going forward and the new age that is coming with the AI and the data analytics, data prediction, and use of data is going to be key. And with that, uh, uh, before we close, just like to have a last thought about the data, leveraging the data for the operational efficiency and the better patient outcomes. Okay, what is the last take you like to take?
Last take is, I would say, there is a simple framework, right? It's called a DIKW, Knowledge Management Framework.
It's
Data, information, knowledge, and wisdom. Wisdom is where you take those decisions. Now, off late with the introduction of, let's say, machine learning and AI, right? So you added two more layers onto that,
correct,
right?
correct.
So where you add insights after information, then you add artificial intelligence after wisdom, which is the decision layer, automation layer.
Okay.
So
Yeah,
the point is, there are a lot of things which are kind of frameworked scientifically, and somewhere we are missing these kind of implementing these kind of frameworks when we look at the data part, right? So,
correct.
so we also need to ensure, and the last point is we need to have see hospitals shows a lot of data, agreed, right? And most of it is related to operational. Now, what I have seen is you don't have somebody with who understands the operations end to end. So quality team gets into the clinical quality and all that, right? So ideally, when we have those capabilities built in, or you have somebody who is qualified as a Lean Six Sigma expert in the system, then obviously they will tell you how to look at your operation data and how things can be efficiently built.
Yes, right. Definitely. So efficiency is the key when we look at the data. Yes, and that's what we say. Okay, data doesn't
We
make
look at efficiency in in operations, right? Then we look at effectiveness in treatment.
correct. Yes, that's
So
what.
efficiency guarantees effectiveness in treatment.
Right, right.
Maybe I think you can take this as a last punchline for me.
Yeah, right, right. Coming to the same note, yeah, so it's the same statement. Just reiterating, data doesn't make the hospital better. The decision too, but
Yeah,
the decisions are based on basically, obviously, on the data. So
yes,
that's not just monthly reports basically. So the data has to be interpreted in such a way, it has to be used, leveraged to come arrive at the decisions. That's the key note. I'd like to take it at. Yeah. Thank you. Thank you. Uh, it was nice connecting to you. And definitely, this discussion reinforces the important point about leveraging the data and implementing more technology, structured data, right and accurate data interpretation, and having that mindset to use the data and placing those data governance, reinforcement, and technological assessment, and redefining the policies and the processes is key to take this ahead. Yeah. The right data strategy and the right set of data sets are very important.
absolutely. So there's a saying, right, as an end note, culture eats strategy for breakfast. If you're not formed your strategy based on data, and obviously this will happen. It will not eat you for breakfast, it will eat you for lunch as well as for dinner.
Correct. Rightly said. So, thank you, thank you very much for all this
Thank you,
conversation.
Mandarji.
Yeah, it was nice connecting to you. Thank you. Yeah,
Same here as well, and have a great day. See you.
great day, great day.